Okay, so hello everyone, and my name is Hiranyada, and today we will be covering the topic of tumors of the larynx and the trachea. So, starting off, first of all, if you look at this blue picture here, this is a picture from one of the slides, and over here, whenever we're like doing a tumor question, so first of all, we start off with the tumor-like affections or something that looks like a tumor, but it's not really a tumor. So could be a nodule or a polyp, or maybe an ulcer for that matter. Then there is precancerosis or lesions that precede the cancer, followed by benign tumors and malignant tumors. So when talking about the larynx, first of all, we have pseudotumors or the tumor-like affections, which basically means that they are structures which resemble a tumor but are not a tumor in general. So the things that we need to cover here are the reactive nodules. These reactive nodules are vocal cord nodules or polyps. So what happens is that these reactive nodules, now, what do you mean by reactive? Reactive means that they are formed in response to a particular insult, maybe in response to inflammation or to any other reaction, or maybe to overuse of the vocal cords or something like that. So first, what are these reactive nodules? They are basically fibrous tissue which is covered by the squamous mucosa or the stratified squamous mucosa. Sometimes they develop in vocal cords, and basically, like for most of the things, they are usually found in heavy smokers or people who strain the vocal cords. So as I mentioned, when we say if something is reactive, that means it is in response to something. So it is in response to either heavy smoking or by putting a great strain on the vocal cords. So again, singers and heavy smokers are the ones that are affected, and this mucosa may appear ulcerated. Ulcerated, why? Because there is trauma, repeated trauma to the mucosa, and because of that, there are ulcerations. So now, when we talk about these nodules, we divide them into two. So the nodules are basically called the Singer's nodules, as they're famously known, which are bilateral lesions. And if you see a unilateral lesion, then you call it a polyp. So Singer's nodules, bilateral lesion, polyps, unilateral lesions. This is for the larynx, and we're talking about pseudotumors here. So now what does a nodule look like? Nodules can either be round, or they can be pedunculated, or they can just be sessile, which is like not elevated from the surface or something. So over here, if you see that they, as mentioned before, they're covered by the squamous epithelium. Because of these insults, they can become keratotic or hyperplastic, or they can become dysplastic, forming some sort of a precancerosis. And why does ulceration happens? As we said that ulceration happens because of contact. So if you have bilateral nodules, for example, if this is your larynx, you have one nodule here and you have one nodule here, and whenever you're talking, there is friction between these two nodules, and the rubbing between them causes them to ulcerate. So that is why you see ulceration. And how would the patient present with such nodules? You will see that there is a change in the voice of the patient. So the patient's voice will get progressively hoarse. So for benign tumors, we have what is called as the squamous papillomatosis or the squamous papilloma, which is also called as the laryngeal papilloma. So it's a benign neoplasm. We're talking about a papilloma, which is epithelioid in origin, and it's benign. It is located on the vocal cords itself, and they look like raspberry proliferations. So if you look on the picture over here, you can see that this structure, which looks like a small raspberry hanging off the vocal cord, is your papilloma, and this single structure is a nodule. So just basic histology, they have finger-like projections and they have a central fibrovascular core. So these are the projections covered with the stratified squamous epithelium, and inside them you have vasculature. So you say that the core, which is the center part, is fibrovascular, and the projections are covered by your stratified squamous epithelium. So that's what's written here. And of course, these are on the surface and the edge of the vocal cords. So any kind of trauma or friction can cause ulceration and hemoptysis or bleeding. So they are seen in adults. In children, if they're found, they're usually found in a large number. So there are multiple of them found in children. And the cause for this is the HPV 6 and 11, and they can be fatal. Why can they be fatal? Because as I said before, that they might come in contact with each other, and there might be friction between them. And when they're coming in contact with each other, they essentially then block the laryngeal path. And when they block the laryngeal tube, that is what causes suffocation. So a patient essentially might not die due to the cancer itself, but he or she might die due to suffocation. So this is about the benign tumors. Uh, One thing to note is that they usually don't become malignant, but they can reoccur. So for malignant tumors, we have laryngeal carcinoma. Laryngeal carcinoma, as the name suggests, carcinoma, it arises from squamous cell carcinoma, which is seen, and the typical patient for this particular cancer is a male who is a chronic smoker, and it usually happens to men who are in their sixth decade of life or who are above the age of 60. Other risk factors for this include nutrition, asbestos, irradiation, infection by HPV, and also alcohol. So, how does this particular tumor or how does this particular cancer progress? So, there is hyperplasia of the squamous epithelium within the larynx. This hyperplasia then transforms to an atypical hyperplasia. And once this atypical hyperplasia happens, there is dysplasia. So now, after this dysplasia, you have the carcinoma in situ lesion, and which further transforms into your invasive carcinoma. These changes are gradual, they happen gradually, and they get worse with years of heavy smoking. But on a positive note, they can regress if you stop smoking. So this is about the basic pathogenesis. Then moving on to the macroscopy. So how does this particular cancer look like? So there are epithelial changes, and they can be smooth, white, or red focal thickenings, or they can be ulcerated. So basically, what I mean by this sentence is that this particular cancer can appear in very different forms. So how would the patient appear? The patient will have persistent hoarseness. He or she might have dysphonia and dysphagia. That means difficulty with swallowing. Now, prognosis of this particular cancer basically depends on the location of the cancer. So there are three primary locations that are described. So it can either be subglottic, supraglottic, or glottic. So again, for prognosis, the supraglottic and the glottic have a better prognosis. Why? Because they get diagnosed sooner because of appearance of symptoms sooner. So because the glottic affects the true vocal cords, and with supraglottic, there is lymph node metastasis, and it involves the ventricles and the arytenoids. With subglottic, we get to know only once the disease is advanced, and it has a poor prognosis because it is limited to the walls of the subglottis and only becomes apparent when it's way too deep within the structures. So this was the classification on the basis of the location and the prognosis. Another way to classify malignant tumors or the laryngeal carcinoma is on the basis of origin. So if it's within the larynx or within the larynx proper, we call it intrinsic cancer. Or if it arises or extends outside the larynx, we call it extrinsic. So within, intrinsic; outside, extrinsic. And again, as I mentioned in the pathophysiology, that they begin as in situ lesions that appear somewhat gray in color on the mucosal surface, and there is a degree, and then as they progress to your invasive carcinoma, they have some degree of anaplasia, but it's highly variable. So yeah, the risk factors are highlighted here: cigarette smoking, alcohol, and squamous papilloma or squamous papillomatosis associated by the HPV. The second part of this particular topic is tumors of the trachea. They are pretty easy and there's not much to it. So we have benign tumors. Now the trachea has cartilage. So from the cartilage, we have the cartilage tumor, which is called the chondroma. We have something called as a chondrohamartoma, which is a pseudotumor. Then we can find a papilloma, again associated with HPV and smokers. Or we can find hemangioma, which is tumor of the blood vessels. Hemangioma is often seen in children, and it starts off and appears very suddenly with dyspnea, and it can be seen in children who usually have a hemangioma birthmark on their skin. So this is about benign tumors. Again, the trachea has cartilage, so a tumor related with cartilage. It has blood vessels, so we have hemangioma, and it has the squamous epithelium, so we talk about papilloma. Then there's also a group of malignant tumors for the trachea. Of course, we have the squamous cells, so squamous cell carcinoma, which is the most common one. Again, it is linked to cigarette smoking and is very rapidly growing. Cigarette smoking causes metaplastic squamous cell growth, and this leads to carcinoma in situ and invasive squamous cell carcinoma. Another one is the adenoid cystic carcinoma, which is more like a glandular tumor, which forms cysts, and they arise from the tracheal glands. These are well differentiated because the name precisely is very typical adenoid cystic carcinoma, and they are slow growing. This particular type of carcinoma is not related to smoking. Okay, so before I end, I would like to mention something called as lymphangitic carcinomatosis. Lymphangitic carcinomatosis is basically infiltration and inflammation of the lymphatic vessels secondary to the spread of malignancy from the first site. So basically, when the cancer spreads from the from the site of where it has occurred to another site, it causes inflammation of the lymph vessels, and that is why it's called lymphangitis. And this lymphangitis is because of the cancer, so lymphangitis carcinomatosis. Now, this particular thing is associated with a few malignancies, not all of them. So you can see it with cervical cancer, colon cancer, stomach, breast, bronchiogenic carcinoma, pancreatic, thyroid, and laryngeal cancer. So there is a short mnemonic if you want to remember it by this, but yeah, don't forget that with laryngeal cancer, you see this particular inflammation and infiltration of the lymphatic vessels. So this was all from my side about the tumors of the larynx and trachea. And thank you for your attention and hope to see you in the next one.